Hi, welcome back to AstroMedic Insights, an astrology collab between myself, Jaymie from J Me Scorpio AF, and medical astrology Dr. Maria Johnson. We're super excited to be here. This is a highly requested video on parasite cleanse and what other detoxes to pair it with. Maria is going to be sharing with us the information from a medical perspective. Her background, she is a doctor, an emergency doctor, surgeon, an Ayurvedic practitioner, and she has combined experience with medical astrology, regular astrology, and so she's going to be introducing us to just the medical aspects of parasite cleanses, and then we'll be telling you the best kind of cleanses to do. And I have a background as a medical researcher, and I've been trained in medical astrology as well. And so I'll be layering on the emotional, psychological, spiritual aspects of what Maria is mentioning, these other things that influence you, and some practical steps that you can take in order to implement this just in time for Virgo season. Hi, Maria.
Hi, Jamie. Hello, everybody. I'm glad to be here to talk about this topic because I think it's very important. As Jamie already said, I will talk more on the medical perspective because we have to be careful, just saying it in advance. We tend to self-diagnose ourselves. If you have this symptoms and that symptom, you say, oh, I have parasites and this and that. And I want to make people aware that they have to be very careful. Not whatever symptom, it's a parasite, because you can have tests. I will explain it. But I wish that people understand the mindset. Not everything that have, if you can have 100 symptoms, but it's not said that you have parasites. You can even you can see it in the stool and then you're sure that you have parasites. But I'm just saying, I will explain what a parasitic infection is and so forth. But from the medical perspective and how you can use as well both allopathic medicine, which is chemical stuff, and herbs. But those can be combined to have a better result, and as well not to harm your body. I don't come with crazy diets and this and that because we have to be very careful. We have to be mindful about our body because we tend to, it goes like a hype, and people say, I want to try this diet and that diet.
Yeah.
Just be careful. This just as a mindset, okay?
Absolutely. And in fact, after Maria tells us about the medical aspects of things, before we give you guys specifically what we recommend, I'm going to give you sort of a mindset around like an insight into really identifying what is and like what's actually best and what's out on the market and stuff, because there's so many different products that actually treat parasite cleanses, but you do have to consider what's actually best for you. And that's where astrology is really able to give you custom tailored insights, which, you know, if you're interested in that, Maria and I, you know, will be happy to provide you with a personalized consultation. But there are also ways in which, and I'm not going to get into it now, but I'll tell you, you know, throughout this video, the mindset, because we live in a world of content pollution. Everyone's going to be like, oh, this is really good. This is really good. This is really good. So I want to give you the information so you can make informed decision and realize, oh, wait, this isn't actually best because it doesn't have these qualities. It doesn't have these features and stuff like that. The best treatment is minimum effort, maximum results. And I'll explain to you guys what that means. And another thing I did want to mention is that Maria and I have a special offer. So stay until the end of the video and we'll let you know what that is. We want to get some feedback from you. So anyways, that's just what I wanted to share. If you want to get into it, Maria.
So what is a parasitic infection? Parasitic infections are any illnesses or conditions caused by parasites living and reproducing in your body. Parasites are organisms that need another living thing, and we call it, in medical terms, the host. We will be the host, okay? Then, wait a minute, because I have my notes, otherwise I forget half the stuff. So the parasites get the nutrients and what they need to survive inside our bodies. Parasitic infections often cause intestinal illnesses. I will mention what it causes afterwards specifically, with symptoms like, especially it's diarrhea and even vomiting. But that is not only that. They can also give itchy skin rashes or infect other parts of the body, like brain or lungs. So it's not only the skin. Okay, that's why we have to be very careful how we say it. So there are many types of parasitic infections. There are three main ones of parasites that cause infections in humans: protozoa, helminths, and ectoparasites. The protozoal infections means there are single cell parasites. They can infect your blood, the intestinal tract, the gut, brain, skin, eyes, other parts of the body. Okay, helminth infections is a general term of parasitic worms. Scientists further classify them as flukes, trematodes, type worms, roundworms. It goes larva, both adults and immature. The larva. Okay, helminths can infect anybody. Helminths usually infect your intestinal tract, but they can also infect the skin, the brain, and other tissues when they travel through the body, because they are very clever and they find a way to travel as they wish. Okay. Mm-hmm. Ectoparasitic infections are insects, for example, spider-like bugs, for example. They borrow our skin and live there. They love our skin. This includes, for example, ticks. They're very, very dangerous, not only for us humans, as well for animals. Mites, for example, lice and fleas. They usually don't infect other parts of the body. They stay normally in one place. What are the most common parasitic infections? Millions of people around the world get parasitic infections. Depends as well, of course, on the area. The most common parasitic infections include malaria, for example, toxoplasmosis. I'm sure you have heard about this. Head lice. I mentioned this, like I would say it in Latin, giardiasis, and pinworms. Other examples, for example, parasitic infections, trichomoniasis. This is all Latin. Tapeworm, leishmaniasis, even dogs can have it, and schistomiasis as well. But this is, as I said, is very medical. I don't want to give people too much of the medical terminology. The symptom causes. What are the symptoms of parasitic infections? Depend on where, of course, where you live, and as well in your body you are infected. Some common symptoms include allergies, anemia, constipation, a craving, but especially sugar, anything that is really sweet. Diarrhea, as I mentioned before. Fatigue is always this fatigue symptom, or that we feel like being below zero with the battery. Fever causes thinking. Gas and bloating, irritable bowel, it's IBS. Joint and muscle aches. Nausea, nervousness, and I said rashes, hives, eczema, sleeping disorders, and vomiting. Okay, these are the main ones. And as well, depending on where the body is infected, they might have neurological symptoms like seizures, severe headaches or disorientation, skin symptoms like redness, itching, rashes, or sores. Sometimes parasitic infections don't cause any symptoms. We don't even know that we have them. And most importantly, I think, is how do we get parasitic infections? Parasites can enter the body in various means, including contaminated food and water, For example, eating undercooked meat, raw seafood, or drinking unfiltered water. Poor hygiene practices, not washing hands properly after handling animals or using the toilet. Traveling to high-risk areas, visiting regions where intestinal parasites are more prevalent. Contact with infected individuals or animals. Some parasites spread through direct contact. And you can get parasitic infections from drinking, I said, contaminated water, eating undercooked meat, mosquito bites, tick bites, fly bites, or other bites from insects that carry parasites. Contaminated surfaces, even soils. I have to mention unprotected sex. And sometimes in pregnant women, some parasitic infection can pass from the mother to the fetus. So they have to be very, very careful that it doesn't go to the fetus. What are the risk factors for parasitic infections? Some parasitic infections, like pinworms, for example, are common all over the world. It's not this is a specific area, okay? Many other parasitic infections are more common in rural areas of the world without developed sanitation systems. This is the risk areas. People who are at higher risk for parasitic infections include young children, for example, the parents, of course, the caregivers, people with compromised immune systems. This includes HIV, cancer, or immunosuppressive medication. How do we test it? Besides the one that's the self-diagnose, okay? How do we detect if it's really parasites? We give the diagnosis of parasitic infections by looking for parasites or signs of parasites, like the eggs, for example, in body fluids or tissues. To test you, for example, for parasites, a provider with doctors might take samples of your poop, anyway, the blood, skin, or other affected tissue. Black is the sputum. Fluid around your brain and spinal cord. If it's really very bad.
Yeah.
X-ray, MRI, or CT scan can as well diagnose, okay, parasitic infection, depending on your symptoms, of course, all the time. So these are the normal tests that we usually do. And how do you know if you have really parasitic infections? As I said, not everybody has symptoms. That can be to any other similar disease that is around. The only way to know for sure if you have a parasitic infection is to have a provider evaluate you, as I mentioned just before. Management and treatment. How do we treat these super bugs? Because I call them the super bugs. We use, as doctors, different medications to treat various types of parasitic infections, including antiparasitics, antihelmintics, or antiprotozoals. Is when you have just one sort of cell that is working in the body. Antibiotics, of course, all the time. Even antifungals. Sometimes you might need still a combination of different medications to cure the infections. We usually provide or select, depending on the diagnosis or on the findings, treatment that is best for the specific type of parasitic infection that the patient has. And I think this is very important because, as I mentioned before, I don't like myself to take chemical stuff. If I have to take an antibiotic, I have to take an antibiotic. If something is really, that I have no time to play around with. Otherwise, I would take plant-based medicine. But you can combine both. even for your gut. Okay, that is very, very important. What I want to mention first, what is it that we can get? Wait a minute, I have it on another. Where is it now? Hang on, please. As I said, what we can get, or the symptoms that we get, or common signs, is as well anemia or allergies, just to say. But it's important to understand that all the symptoms is perhaps not only one cause or disease. Okay, this is what I want to make people aware of it, because symptoms of parasitic infections can be similar to many other infectious diseases. Okay, the only way to know for sure, as I said, is to get an evaluation by a doctor. I can't stress that enough, because if you try to do everything on your own and you don't know the cause, because you want to treat the cause, then you actually destroy your body even more. Okay. How do we treat them? As I said, with this medication, sometimes we would be exposed with plants if the doctor is open enough. Okay. So, but how do you get rid of the parasites in the body? Most parasites will only go away with medication. It's hardcore, okay, or a combination of medications, as I said before. We treat some skin infection like mice and mites with medicated lotions or shampoos. This is on the outside. Outlook and prognosis. What can I expect if I have a parasitic infection? Depends on what kind you have, how severe it is, because we have to assess this too. Whether or not you have a compromised immune system, how well you respond to standard treatments. This is as well to think. Some parasitic infections respond well to medications, but some infection can last for a long time or keep coming back. That's why it's important to talk to a doctor and to say whatever that this person has. Prevention, we can prevent it, of course. When we, for example, wash our hands frequently. I don't say that you have to wash your hands 100 times a day. When preparing food, before eating, after going to the bathroom, or whatever you do in your daily chores. Don't swim when you have diarrhea, for example. Wait until you haven't had diarrhea for at least 2 weeks before swimming in a public pool again, because you can infect others. Okay, practice safe food habits. This includes storing food properly, heating meat and poultry to a safe temperature. I'm just saying, washing or peeling fruits and vegetables before eating. Protect yourself from bug bites. I hate them too because the mosquitoes love me. Wear protective clothing, use bug spray, and sleep on the mosquito net if necessary. Okay. Be an informed traveler when you travel in risk areas, for example. Learn about infection diseases in your destination that you may need to take special precaution against. Some precautions might include taking prophylactic medication. That means before you travel or to get sick or get even vaccinated. We have here a special center for that. When you go in risk zone, you must have it. Otherwise, you will not be able to travel. They block you already at the airport. As I said, when do you go to a doctor? If you have the symptoms and you travel a lot, or you have it since more than, for example, 2 months, or that you have been bitten by a tick, a mosquito, or another stupid bug. If you remember that you got bitten, because sometimes we don't even realize it. That you have perhaps swum in water that could have been contaminated, ate or drank something that could have been contaminated. Then you should perhaps go to even emergency. When to go to emergency? If you have a fever higher or at 40 degrees Celsius, I don't know if it's 100 and something Fahrenheit. If you have seizures, confusion, disorientation, yellowing of your skin or eyes, this can be a sign of jaundice, for example. Dehydration, like extreme thirst, peeing very little, weakness, and high heart rate. Also, the questions that you should ask your doctor. This might be helpful, okay?
So helpful.
Because yes, I am a doctor, but you as a patient, you have to ask me whatever you want to ask me, and I try to, the best of my abilities, to give you an answer. If I don't know it, I will tell you I don't know. I'm just saying. You can say, how did I get this infection? What are my treatment options? I am contagious. You might be. How long until I feel better? It's depending on of course, on the diagnosis. How can I take care of myself at home? What new or worsening symptoms should I look out for example? When should I follow up with you? So parasitic infections affect, as I said, millions of people worldwide. Some didn't even show anything at all, while others develop life-threatening symptoms. Okay, so you can also take precaution to protect yourself against infections, as I said before. How do we treat it? There are several methods, put it this way. And the one that I find very, very important is, besides what I mentioned before, how you can prevent it and so forth. For example, with a parasite cleanse. But I'm not coming with this hype. You should do this brilliant and magic diet. No, I don't come with the BS, because it doesn't help. I wanted to stay healthy, even if you do a diet or a cleanse. Okay. The parasites detox, because I call it detox, focuses on a dietary changes that may help support the overall gut health and discourage parasites growth, because they like to, as soon as they find you as a host with the appropriate amount of poison, put it this way, and they live from us, then they grow and grow and grow. So the approach includes several different methods: restricting parasites fueling foods, eliminating sugar, processed foods, and refined carbohydrates, the fast way of cooking. Incorporating antiparasitic foods, consuming garlic, ginger, carrots, oregano, and pumpkin seeds and papaya seeds, because also these two.
Love that.
If you combine, because you have to combine them to work properly. This is also the thing. Okay, I will talk more about the pumpkin and the papaya afterwards, because I have seen improvements in many people. Supporting gut health, because as you mentioned before, the gut and the brain, it's a how do you call it, a highway or the motorway to the brain via the vagus nerve, and then you get foggy, you're disoriented, and this and that. Okay, it goes up again to the brain. That's why the brain, you can even have it in the brain. So eating fiber-rich and probiotic foods to maintain a balanced microbiome, because it comes back to the microbiome at the end. And enhancing the detoxification, drinking plenty of water and including liver supporting foods like leafy greens, because the liver, as most or the biggest internal organ that has over 500 functions, is overloaded, because it can have it. The parasites, they love as well any metals that are inside us, mercury and so forth, even mold. Okay, so they is not only what we eat, but what is also around us. Foods to eat on a parasite detox diet. Certain foods are believed to support gut health and may help discourage parasites activity, including high fiber fiber foods, fresh fruit, vegetables, nuts. We forget always about the nuts. It's very good for the brain. And various seeds to aid digestion. Anti-parasitic herbs and spices. Garlic, as I said, and oregano may provide additional support. Probiotic-rich food, yogurt, fermented vegetables to promote gut flora balance, and healthy fats, because at the end it comes always on what we eat. We are what we eat. Coconut oil, olive oil, flax seeds, for example, for the antimicrobial properties. Okay, this is very, very important. As I said, I don't give you a hype, the newest diet and magic pill. It's not magic at all. You have to work on yourself. Foods to avoid on a parasitic plants diet. Certain foods, they contribute to parasites survival or disrupt the gut's natural balance, of course. Common foods include here sugary foods and beverages, and soft drinks, okay? They encourage the parasites to grow. Processed food, as I said before, artificial ingredients and preservatives may disrupt gut health. This is especially in the Western countries, not in other countries, but in the Western countries, this is a big issue. Alcohol, for example, and caffeine on a certain level. This might interfere with natural detoxification processes. Raw or undercooked meat can potentially carry parasites, eggs or larvae of parasites. Okay. I have forgotten to mention, when you don't know how to handle yourself anymore, that you have pain, when you have persistent digestive issues, unexplained weight loss and fatigue, say you were traveling somewhere in risk areas, lack of symptom improvement, then you should really go and see a doctor. If you like it or not, you have to know what is wrong with it, because you don't have to ignore persistent symptoms. Then you have to see really a professional medical doctor. I wanted to say about the pumpkin and papaya. Pumpkin and papaya seeds and their effects, because you have to combine both. They improve, and how should I say it? Pumpkin seeds, especially from the cucurbita species, have been traditionally used as natural remedy for intestinal parasites. They contain a compound such as cucurbitacin, which is believed to have anti-emetic properties, in the sense parasites. It can help expel parasites, worms. There are enough studies how that show the pumpkin seeds can help paralyze and expel parasites, especially tapeworms and roundworms. However, even if they paralyze it, making it easy to expel from the body, they do not necessarily kill them. Okay?
Yeah.
Papaya seeds have been studied for their potential antihelmintic properties. They contain enzymes like papain. It even helps to actually lose weight, papain, which is thought to help break down proteins and potentially dissolve the protective layers of parasites. There is enough evidence suggesting that papaya seeds can help in reducing parasitic loads.
Mm-hmm.
But this is primarily based on animal studies, of course, and limited human trials. I have to say that. So, but both pumpkin and papaya seeds taken together, they're helping to manage the intestinal parasites more. Research is needed, of course, as usually, but both combined, they have one is paralyzing them and the other one is expelling it.
Mm-hmm.
Okay, so I give even to avoid that you can get actually parasites, I use zeolite. I have mentioned this already once. Zeolite is helping. It's like a magnet. It's natural. It's actually from the volcano, if you want. So there are 41, but there's only one that you can use for animals, for humans, and even for plants. Zeolite is, I said, is like a magnet. It is taking whatever is bad in our body, and with time, of course, and when you change diet as well, is expelling it. Zeolite is besides the papaya seed and the pumpkin seed, oregano, or whatever, other herbs, ginger, garlic. Garlic, I would be careful because people with low blood pressure should not eat garlic raw because it's actually getting worse.
I wrote that in my notes as something to mention. I'm going to have a little story about that, you guys. Maria upset me when she told me that, but it's true.
So you have to be very careful with garlic. If you have low blood pressure, I use it just cooked, but I mean I don't eat it raw because with Mediterranean cooking we use a lot of garlic. Okay, but it's cooked. When it's cooked, it's different. But if you eat it raw, it really, you have to be careful because it's lowering your blood pressure. So this is the overall about parasites. I don't love them at all myself. I have seen it in animals. Try the quintessence of everything. You have to look what you eat. That is very important. And wherever you travel, if you have immune system problems as well, you can combine the medication that I would give you, the chemical one, with these herbs. Both combined, you have a lower risk of getting really ill. Okay, and it's also that you don't collapse because you're making, for example, a hardcore diet, and not looking that you are replenishing the body, because this is an aspect that most people forget. We have to replenish the body with what we expel.
Yes.
Like vitamins and all this stuff. I think I even mentioned it last time in the last video we made, that we have to see the body as an entire system. And we cannot just say or do this hype, for example, a diet that you see in the internet. I think that is not respectful for the human, because you don't know what you can cause, and everybody is different, and you don't know really the cause, or actually if you're not sure that you have parasites, then you have to be really careful, because it could be an underlying disease. I don't want to promote, that you get only the medical help, but if it's necessary, you have to get the medical help. So at least you know the diagnosis and treat accordingly.
Absolutely. And even if you do have a parasite and stuff, sometimes if your body isn't healthy, just jumping straight into fixing isn't always going to be the best thing. And while Maria was talking, I took down a bunch of notes of things that I wanted to add on to. But one of the things that I really wanted to emphasize for some of my clients, like I've given you consultations and I've told you to keep an eye out for this video and stuff. So you know who I'm talking about. But one of the things and one of the biggest concerns that I have is that, and Maria and I talk about this a lot, like nature is the best medicine. And we're not saying that Western pharmaceutical medicine is bad. There is a place for it, but it's important to understand depending, like if you're dealing with an acute symptom, you have pneumonia, you got shot, you go see a Western doctor. But for chronic issues, the Eastern medicine tends to work better. And one of the biggest problems that I've seen, and this is a bigger problem I've noticed with everyone, but especially women, pregnant women, hormonally sensitive people. And I'm talking about clients of mine who are doctors and nurses in the naturopathic acupuncture community where, like Western medicine doesn't necessarily train you in the same way, but there are a lot of well-intentioned people who have become hyper aware of what makes their gut sensitive. And in their misguided attempt to get better, what they'll do is eliminate anything that upsets their gut, which is really problematic because then you're chopping up your bodily needs and you're acting like your entire body is your gut. And one of the biggest problems that I've seen is, especially with my clients that have strong air in their chart, you use a lot of brain power. Pregnant women who have been breastfeeding, who have given birth, because these things, they shrink your brain. And especially if you have like back-to-back pregnancy, your brain needs glucose in order to function. And unfortunately, a lot of people who have gut issues don't do well with glucose. And so in an attempt to help their gut, they eliminate glucose and then like their brain starts malfunctioning and they start having issues. And even a healthy brain isn't going to do well with that kind of deficiency. But I really want to emphasize that, like, I understand that you want to treat this problem effectively and efficiently, but it's not, you have to be sustainable. You have to be realistic. You cannot be avoidant of other things that your body needs because you want to heal your gut. Like that's just not going to work. And there's, these lead to depression issues, vagus nerve dysregulation, so many different health issues. So it's something that I really do want to emphasize. And some other things I wanted to mention is, when Maria was talking about I'm sorry, let me go into something else. I want to also help you guys to develop a mindset so you can make an informed decision about when someone gives a recommendation for what's actually best, me and Maria included, okay? Like, if we recommend something and you don't understand why, like ask us, because there's always somebody that's like, oh, this is the best thing. And people genuinely have sometimes good results, sometimes they don't, sometimes it's BS. But there are ways to identify what actually is and isn't good for you, because nature is the best medicine and nature is very much about minimum effort, maximum results. And in health, the reality is that everything is interconnected. And so when you have an issue with one thing, whether it's gut health, whether it's parasite, whatever it is, you have other issues going on too, 5, 10, 20 other health issues. And so the best treatment is going to be something that covers multitude of symptoms. So we're going to be talking about what that is. But before we get into it, we still want to talk about other stuff. But just so you know, because like in the US, for example, Renew Life is a really popular brand, and they have stuff for like parasite cleanses, lung detox, liver detox, and all of these different things. And they cost so much money, and you have to like take it for like 7 days, 30 days, 60 days, 90 days, 6 months, or whatever the package says. And they segment it all off. And when Maria and I tell you what we actually recommend, you're going to see like how interconnected everything is. And so it's very much minimum effort, maximum results. So before you're quick to try something because someone says it's good, I want you to get into the mindset of, if someone says, oh, this is the best parasite cleanse, ask them, what are the 5, 10 other things that it's going to treat? Like it should at minimum help probably 10 other things, at least. So that's just something to kind of be aware of. And it also makes it more cost effective. It fits more with your lifestyle and stuff. So that's something to be aware of. And some other things I wanted to mention is, Maria talked about the different ways that you can get a parasite, one of my friend's ex-girlfriend, she ended up unknowingly getting a parasite, and she didn't get her period for an entire year. And they did all the tests. They didn't know what was going on. They didn't think to do a parasite cleanse test because they didn't know she didn't have any digestive issues. I mean, honestly, when you have period issues, you have digestive issues. That's just the period issue, that your reproductive issue. It's a symptom of a gut imbalance. But she's a gardener, and she actually contracted a parasite through gardening. So that's something else, because that one was like super tricky. So just so you guys know, and particularly like this is a generalization, but for those of you who are of the same generation as me, if you're a Cancer rising and you have Uranus in your 6th house Sagittarius, okay, Uranus is about unusual symptoms and stuff. So your health issues may be really uncommon and stuff. And up until I started working with Maria, like I used to have such a hard time, even with like holistic practitioners. Oh my God, I'm so sorry. Holistic practitioners and stuff on, you know, what was I talking about? Holistic, like even the holistic practitioners, they'll go based off of like a treatment based on what's most likely to be the issue. So I want you to know, like, if this is you and you've had issues, it may be better to get like a personalized consultation in order to identify specifically what's going on with you. If you're a Leo rising, you are the same generation as me, you'll have Neptune and Capricorn in your 6th house. And Neptune is about invisibility, confusion, and stuff. So you could also just be honestly unaware. And I know I have a couple of clients, several clients who are doctors who are Leo risings, and they were just like, I'm always helping my clients, but I'm always having health issues. And I'm like, yeah, like that makes sense in your chart. So, you know, there's just some like general insights that I wanted to share with you. And speaking to what Maria was saying, like she's right. You know, it's also important to know how well you respond to treatments, because in the consultation that I got with Maria and in my personal experience, like I don't do well with pharmaceuticals, you know, so that's just a reality. So for some people, you know, it may not be the best approach to take that. And I know some clients have been like, oh, well, my insurance will cover prescription medication, but that doesn't mean that it's necessarily going to help you in the long run. And in regards to stool tests, like I want to share with you some of my examples, some of my experiences, because maybe it'll help you guys, is that unfortunately not a lot of doctors are familiar with tests and lab results and stuff. But if you happen to have health issues and you need to go to like the emergency room or urgent care or something, like ask them to test your stool, because oftentimes what they do is they give you a full spectrum antibiotic. And for me personally, when I got hospitalized, it took me years to realize that I had endometriosis. And when I showed up and like my white blood cell count was up the roof, they gave me like multiple rounds, like I think 3 rounds of like antibiotics. They gave me 2 rounds of STD treatments. Even though I tested negative on all of these things, they were like, oh, she probably got a false negative, which wasn't the case. And so for a while I had antibiotic resistant cells. Now that hospital shut down, so I don't know what like antibiotics they gave me, but I have to be careful now. So that's the other thing, is that if you get intravenous rounds of antibiotics, you could actually have developed an immunity, which can also make it difficult. So that's something to kind of be mindful of. And there were so many doctors that wanted to give me a bunch of different like antibiotics. And I had to be like, can you test my stool? And the doctors were like, oh my God, I didn't even think about that. And I'm just like, yo. So, and something else is that to like, some people, and I'm one of them, have like evening fevers where it's like during the daytime, you're fine. And then, why did Maria leave the, okay, I don't know what happened to her. She should be coming back in. But basically, there are some people where like when you have like an infection, you can have a fever, but some people won't have a fever during the daytime and will only get the fever at nighttime. And I've had that happen a couple of times where I just thought like, I'm okay. I must be like safe because I guess I healed, because like I had a fever yesterday and now I'm fine. And then at night it would keep coming back. So if this happens, you want to make sure to get yourself to the hospital, because when it comes to infections, it can move really, really fast. So just be kind of mindful of these sorts of things. And let's see here. Food hygiene, like Maria mentioned, is really important. Some other things that you can do topically to protect your body from parasites is one, like staying dry and like keeping your body dry. There are deodorants that you can use and stuff, but deodorants actually work better at night and stuff. So going to bed dry is going to be really helpful. And then staying dry all day. Like I used to live in LA, but now I live in Bangkok, and Southeast Asia is very, very humid. So you want to look at what the locals are using in order to figure out like, okay, what do they do in order to stay dry? And the pattern I've noticed is that when you go to a new place, it generally takes people like a month before. I feel like something about our blood is a generalization. It takes like a month in order for the body to, the blood to adjust, and then we tend to be okay. But you definitely want to be careful, like Maria said, when you're traveling and stuff. If you're going to a humid area, if you know you're prone to infections, bug bites, fungal infections, like breakouts and stuff, using soaps that are antibacterial, or you can even use like benzoyl peroxide, which actually like it's used as an acne treatment, but what it basically does is that it kills off the bacteria that causes odor and stuff, and it can also reduce sweating as well. So it's something that you can do. When it comes to bug spray, something I did notice is that a lot of people say like, oh, if you go to like Thailand or like Bali, like don't even get the stuff from your home environment, just use what they have there, because the stuff that you use at home isn't necessarily going to work. But for me, I noticed that the parasite cleanse that they use is, for whatever reason, it's just the parasite cleanse that they use. I'm sorry, give me a minute. Maria just got logged out, so I need to forward her this invitation so she can jump back in. Okay. So what was I saying? Oh yeah. Like a lot of the places I noticed, like it's also about figuring out the ingredients that they use. In Thailand, they use DEET for mosquito bites, and that doesn't work well for my body. So this kind of goes back to learning how well you respond to treatment is going to be something that's going to support you. And another thing that you can also take a look at, and this is something that Maria does cover in her consultation, is looking at your Hygeia placement or Hygeia. It's an asteroid that represents your health. And for me specifically, my Hygeia is in my 7th house, which is one of the houses that represents faraway travels. So when I first travel, I know that I always have health issues, and I have Jupiter and Neptune here as well. And so like these roll like liquid, Neptune rolls liquids and stuff. And every time I've gotten sick, it's been because of some sort of liquid. So if you want information on that, like Maria can cover that. Some other things I want to mention are sort of like the spiritual reasons why you can be more susceptible, because we're spiritual beings here to have a human experience. And so taking care of our physical body is also important. But for people who are like, for example, more water dominant, if you're energetically or spiritually out of alignment, you're more predisposed to having health issues. So like when it comes to like topical issues with like skin infections and things like that, because your skin with your skin is very much a boundary. So when you have boundary issues and stuff, you can also have more issues with the topical stuff as well. So that's something that you can work on, work with your Saturn, work on building your boundaries, things of that nature. And I covered this in a video that I did with Lada on Get Cozy with Money, I think, video, where I talk about like the energetics of like, you can kind of figure out like a person's financial situation based on their stool. And people who are like, who let things go easily but have a hard time receiving will very much be more prone to diarrhea, whereas people who have a hard time letting go of things might be more prone to constipation. So understanding that and looking at, like, if you're prone to constipation, what can I let go of? If you are having diarrhea and you're having a hard time receiving, you're having a hard time digesting things, learning to be more present. These are going to be things that you can you can talk about. Now, I do have a few other things I wanted to mention, but Maria, did you want to mention something about doctors or?
I had lost you for a couple of minutes. I don't know why. Don't ask me technical stuff, the usual rubbish that we have to cope with. I wanted to actually talk about misdiagnosed parasite-linked conditions. I think that is very important because the misdiagnosis, the first is IBS, irritable bowel syndrome.
Oh, I have so many stories. I'm sorry, continue.
And the parasite's truth is Giardia blastocystis. Is the name of this parasite, put it this way. Then the other one is Crohn's disease or ulcerative colitis. It's an autoimmune condition. This is worms and protozoa most likely to put this at the misdiagnosed cause, because I'm talking of the cause. Fibromyalgia, this is like an umbrella. That means we don't know what the heck is going on, but we call it fibromyalgia. Okay, mystery causes. Put it this way. I'm honest. I'm telling you what it is. I'm very transparent. I don't like to tell people BS. They have the right to know it. When we say fibromyalgia, it's just an umbrella of a term that we don't have no clue. So parasites, toxins would be most likely the cause. Chronic fatigue syndrome, the one that I mentioned before. Parasite load, the body is full of it. Then hypoglycemia, it's the blood level, the sugar in the blood, put this way. Disrupt insulin, which is caused, of course, as well with parasites, different ones. Anemia, it's iron. We have deficiency as well in iron. The parasites distill the nutrients, okay? Allergies and asthma. Parasites, antigens, they are as well, they're overloaded. Neurological disorders, brain parasites. They just go wherever they like to. And skin conditions, parasites, the cause is parasites toxin. But eczema, for example, psoriasis, yes, it has to do with the immune system. But don't forget, the immune system has to do with the microbiome at the end of the day. And the cause, most likely, are parasites. These are just one thing to mention before I forget, because we misdiagnose many, many, many things. Yes. It's the way it is. I mean, we are humans, but it's better if you're really not sure about your condition, that you have all the symptoms. I would suggest as a doctor, the first thing that I would do is the test on the poop. Yeah. To be really, really sure that is nothing. And then, of course, the blood. If it's necessary, I would do even ultrasound or X-rays or MRI, whatever. But the poop is the most important, and the blood.
Yeah. Okay. So one thing, you guys, is, Maria brought something up. In the medical industry, one of the things that doctors will say in code when they don't know what the fuck is wrong with you is they'll be like, oh, we're going to send you to a specialist, but I think you have Crohn's. That is literally, that's if you don't have the symptoms of Crohn's, because when it took years for them to diagnose me with endometriosis, which is a reproductive disorder that causes excruciating menstrual cramps, fertility issues. I basically have cell growth outside of my reproductive organs, and it can kind of create a gridlock. They didn't know what it was. And they were like, oh, Crohn's disease. I didn't have the symptoms of Crohn's disease. Like, I knew someone who had Crohn's, and like, if he ate something he wasn't supposed to, he's going to throw up, he's going to shit his pants. I wasn't like that. So it's crazy. So that's something definitely to be aware of for sure. When it comes to, Maria's right, you want to analyze your stool. Stool tends to, at least in the US, like cost more, and it's not oftentimes covered by insurance. If you guys want, in LA, I do know an acupuncturist who will like buy the tests directly and stuff. So it's still pricey for like people. Non-Americans are going to be like, that's so expensive. But for Americans, you can, they literally just charge him for the lab results and nothing extra. So you do get like a discount. With the ultrasounds and stuff like that, they like, hospitals are more quick to do them. I hate to say this, but I'm going to say it anyways. I do know a clinic and a doctor, and I'm not going to publicly put her on blast, but she is a well-intentioned person, very good student. She obviously passed med school, not that bright. I hate to say it, but it's true. And she will do any test that you ask her to do and stuff. You just need to give her a reason. And this one clinic, they hire people who are in insurance companies that were like literally paid to refuse to give people insurance coverage. So they'll get you approved for everything. So if you want to have this information, email me, because I'm not going to publicly put this person on blast, but I can give you her information and you can see her. And, you know, like, let me tell you, especially in the US, they offer a lot of different labs, like a lot of tests, but the doctors aren't trained to understand what they are. So you're going to have to find someone who does understand it, but you can also get like your insurance to cover it. Or if you have Medi-Cal, like the doctors can like make a request to get it waived, just FYI. So something to kind of like be aware of. Other things that I do want to caution you guys on, because I see this happening a lot less nowadays, is that a lot of people will just assume that if something is natural, that they keep using it. And you do have to be careful, because all of the pharmaceuticals and all of that, they come from, it's the lab made version of what's naturally occurring in nature and stuff. So when you're getting stuff in nature, like you're taking tinctures or something to treat your body, think about like the amount of pounds and pounds and pounds of the herb that had to be used. And people are just fast and loose and liberal with like, you know, natural antibiotics. And that's not healthy either. Like, one of my really good friends is an acupuncturist, and, you know, like he always is like, if he gives someone like a natural antibiotic, he pairs it with probiotics or he does something else. And he was like, you have to be careful. A lot of times people don't do that. People just assume if something is natural that it's safe, and that's not necessarily true. And garlic is one of those.
The thing is, people are not aware.
Yeah.
I mean, I don't blame the layman in that sense.
Yeah.
You have to be sure. You should actually know what you can combine and what you cannot combine. This comes as well when I mix certain plants, which they're really potent. And it's like the one thing that you cannot mix magnesium and calcium together.
Yeah.
And the same thing happens with the plants, with phytomedicine. They can be potent, but they can knock you out if you are not aware. And also you don't know how your body will react, because, I mean, for me, even if I'm very small, I'm 45 kilos, is about 90 pounds, more or less. I need, or my body needs, the triple strength from whatever medication.
Same.
But this is why, because I have a very fast metabolism.
Yeah.
Other people, they would just be knocked down with a half of the dosage that I take, or even a quarter. So it depends on your body. You have to be very careful what you put into your body. Doesn't matter what it is. This is actually the core thing. because people get it, and it drives me half bananas sometimes that you see on TikTok, on wherever, on other platforms. Yes, it's well meant because they try to help or whatever. Some people, they just want the clicks and the likes, and that won't help anybody. Please use your brain and discern, because you should know your body the best. I can't emphasize that enough, because it really drives me mad when people say, "Oh, you should take this and you should take that." It's not said that your body will accept it, and it's more harmful than anything else. Okay? You know what I mean, Jaymie?
Oh, okay, you're back. Okay, I don't know who's back or who's not. Okay. But your internet works, so people were able to hear you, so that's fine. I'll have to watch the recording to see what you said. But yeah, no, basically Maria brought up a good point. I'm the same way. Like, we both have really fast metabolisms, and a lot of times the standardized prescription, the dosage that they give, is not based on your metabolic rate, which is mind-boggling to me, because like Maria and I, our body metabolizes stuff so quickly. We need to have such a higher dosage. And so it's funny because like years ago, before I met Maria, I misread the dosage. And so I started taking far beyond what I was supposed to. And I felt the best I've ever felt. And then I started getting scared because I heard that this was poisonous levels. So I completely stopped. But there's a lot of things where I stopped taking the supplements because it didn't work. And it's because I wasn't taking a high enough of a dosage. So if you are one of those people where you do have metabolic issues and stuff, a consultation from Maria, she'll be able to recommend like a specific dosage for you. Like, my dosage for iron is like a lot higher than it should be for most people, for example. And it's literally considered dangerous levels. So, you know, it really does depend. One of the things that Maria said that really bothered me, and I don't think I've ever let this go, I'm not going to lie, is, you know, like she did say like, oh, be careful with garlic for people with low blood pressure. And it's true. A lot of people that have got issues that think that they have SIBO or probably do, they hear about how like garlic is really good for you. And then everyone just like uses so much garlic, you know, and like you're on Instagram and everyone's like, use garlic until your ancestors tell you to stop, you know? And I used to use like whole ass, like heads of garlic and stuff. So that was really upsetting to me. But yeah, like apparently you should stay away from that. It's very annoying. And that's also really important because when you do have parasites and stuff, like they are literally leeching off of you. So a lot of people will have like their energy is weaker and stuff. So you could have low blood pressure for that reason. And then you're taking stuff that's like making your blood pressure even worse. And so it's just like this really like vicious cycle. Something else is, you know, in addition to what Maria mentioned about the questions that you should ask, which you absolutely should, I would also say like asking nurses and asking nurses, because they tend to be the people who talks to everyone and stuff, and picking hospitals and clinics that have a really good organization system, like with scheduling, like the admin is really good. These are really good indicators of good people to see. There's always this correlation if they can't get scheduling right, like it's such a hot mess in there. I don't want to get into this too deeply, but astrologically, you can also kind of look at what does and doesn't support you as well. There's parts of your chart you can look at to see the archetype of like the best doctor for you. And for me personally, the two planets that represent women are a little bit more challenged, whereas the planets that represent men work really well for me. And interestingly enough, I've noticed that before we cut out, I was mentioning that some people will get fevers at nighttime. And so you have to be careful with infections, because like you think that you're healed the next day because the fever goes away. And then at night it comes back, and infections can be really insidious. So you have to be careful. And whenever I would go to urgent care or emergency room at nighttime and I dealt with women, it was just like crazy because of the energy of that hostility. But then a man would step in, and it's so weird. We live in this toxic patriarchal society, and like I have more positive experiences with men, but that's because the planets that represent men work a little bit better for me. So if you know this about your chart, like some people have phenomenal relationships with women, right? Just try to seek out a woman. You know, if you have issues like on the opposite end, you know, like look at that, or, you know, like not saying don't turn this into an opportunity to be rude, but just, you know, you can use these things as an advantage to kind of leverage yourself. And my sun is in planetary joy. It's in the 9th house, which is between the hours of 2 to 4 p.m. So when I don't feel well, now I go to the hospital during the daytime. I don't
look at Jaymie. Usually fever rises in the afternoon.
Yeah.
So even if you had, I don't know, everything was okay, but in the afternoon, even with children, it's the same thing. It rises in the afternoon, and at night is much higher than usually in the morning. So you can say, well, I'm fit. No. Wait until the next morning, or actually the next afternoon if you don't really have fever, because it tends to go up in the afternoon. Then you can say, okay, it's fine. But consider that as well. Fever arises always in the afternoon.
Yeah. Mine really spikes at nighttime. It's crazy. Like, and I know a few people, like some of my clients who are like doctors, who are like, oh yeah, my kids are like that too. And I don't know, it's a really weird thing. So
I have that too, Jaymie. I have very high fever very fast. It lasts for a couple of days, and I think that I'm half dead, and then it disappears as it came.
Mine is like, I just have one day at night, and then I'm fine. And then at night, and like when I got COVID, I didn't realize I had COVID because I didn't actually have a fever. But at night, I didn't have the strength to flush the toilet. Nobody told me that that was a symptom of COVID. I never coughed. I tasted everything. So it was really weird.
So it's very individual, but I'm just saying people have sometimes, you know, this is not even really fever, but it's dragging for weeks. And I would prefer for them that they have really like a spike. They have about 3-4 days high fever, and they're over and done with. Instead to have it 3 weeks and you drag it with you, poor things. I have had that several times with patients.
Thank God I haven't.
No, we burn it as well as the metabolism. The metabolism plays a role as well. Okay.
Yeah, absolutely. So yeah, I feel like we did a good job kind of explaining the parasite aspects of things. Is there anything else you want to include, or do you want to recommend the cleanses or the detox? Or
well, as I said, I mentioned which plants they can combine if they have the access to buy zeolite.
Yeah,
because zeolite is natural, and zeolite is really a magnet. I use it a lot. I use it even for my plants. I'm not joking. When I water them, they are growing, they are blossoming. I give it even to Aurora, my doggy, just a little bit in her food, you know, that she's eating, to cleanse her, even if she's only 6 months. But I want to prevent whatever it comes, because we have sometimes even ticks here, and I hate them really. I found one. She had it on beside under her chin, and one of the signs. Really, you know when an animal is vomiting, is a tick, and unfortunately they are everywhere. I have to put the special disgusting blend that I've made for her. It's neem oil, oregano oil, rosemary as well I have inside, because neem is really not smelling.
neem is great. Yeah,
but
it's effective. Yeah,
it is effective, and I had forgotten to actually put it on her. It can be even good for humans, not only for animals. But I'm just saying, try to treat your body as a temple. put it
Yeah.
this way. And
So
honor it. It's not much more that I can say.
yeah. So yeah, Maria mentioned the zeolite and the fulvic acid. These are great combinations. They help to detoxify the liver and parasites, and they work like a magnet. And one of the things is that sometimes, depending on what kind of parasite that you have, and particularly for people who have Neptune in their sixth house or like Neptune on their ascendant, especially, like it can be very hidden. And the thing is that a lot of parasites are actually hidden inside your heavy metals and stuff. So yes, it's important to know what you have, but there are certain things that you can do. So going back to, what I was mentioning earlier, where I was saying that, like, whatever treatment that you use to heal your body, the best ones are going to be full spectrum and they're going to work for multiple things. So that's the thing with fulvic and zeolite. Specifically with zeolite, the one that you want to use is the one that's safe for children and pets and animals. There's only one that does that, and the name is like cliptinolite or something. What is it?
Cliptocinolite. That is the only one that you can use without any risk. As I said, I have been given it to my animals, to adults. I take it myself, even to my granddaughter. Okay, she's not a baby, but she's still a child. You can give it with really no headaches. I will be careful. It has to be that one. Don't take anything else. Okay.
Yeah.
That is very, very important. And try to practice safe food habits and change your eating habits. That will help you a lot.
Yeah, absolutely. And what was I gonna say? Yeah, so like, as far as like it being full spectrum, so it helps with multiple things. With the liver, it has over 500 different functions, but this combination is often used by mothers with neurodivergent children that have ADHD, autism, kids who had food aversions, texture aversions, or were non-speaking, non-verbal. They start taking this, they start detoxifying their body. They start developing more neurological development and stuff. It really does help with the body, and neurodivergence in particular do also accumulate more toxins and retain them more too. What's great about these things is that it's not like, getting something from like Grateful, whatever that brand is, or Renew Life, where you have to like take the supplement like every day and people are scared that they're gonna like shit their pants and they can't leave, and they have like really aggressive formulas and stuff. And I've had like my friend is the acupuncturist look at the dosages, and he'll recommend a different dosage for me because he's like, you're a smaller person, so you don't need something to be as aggressive and whatnot. And so that's the other thing, is that if you're smaller, you could be over like cleansing yourself as well. And then, like Maria said, with like it could, on the other hand, it could be that your metabolism is like burning it off so quickly that it's not effective and stuff. So with fulvic acid and zeolite, you take like one of the best forms is like tincture and stuff. You put it under your tongue, it goes straight to your bloodstream. It's easy to do. It's very user friendly. So it's something that I do recommend. It works with your daily lifestyle. You don't have to make these plans and stuff. Another thing that Maria introduced me to that I really want to recommend is the shilajit resin and stuff, which is a rich source of minerals. It also has fulvic acid. And one of the things is, like, I don't want to just explain to you like, oh, this is what you should get, but understanding the mindset of like why something like this is so good is that, one, it's a resin. So it's in the purest form. It's had the least amount of adulteration and stuff. And the best brand and the best one is the one that comes from the Himalayan mountains and stuff. And I almost went crazy because different parts of the Himalayan mountains has names. And I was about to research the best names. And then I remembered I'm an astrologer. So I just looked up in Horary, which is a branch of astrology where you could ask specific questions, and I analyzed which company had the best one. And it's basically this resin form. It's a rich source of minerals and stuff. It's got a lot of really great things. It contains fulvic acid. I think it's like 12 different types of heavy metals that it actually extracts. And so, like I said, when you have a bunch of heavy metals, that's where your parasites hide. So, just in general, like if you don't know what you have, this is a good way to kind of look at it. And this is much gentler and stuff. And, like I said, it's full spectrum. This isn't just something that helps with parasite cleanses, but it does help with parasite infections, chronic fevers, jaundice, obesity, sexual and thyroid disorders and stuff. And depending on who's marketing it, like Shilajit is almost seen as like a natural Viagra. And you guys, I actually know an astrologer who like publicly was like, he was working with someone and they actually mentioned like in a text message, like, oh, like sexually, it was really helping. And he was like, oh, my dick got bigger and this and that. So it's like an actual thing, you guys. So instead of using Viagra, you could use Shilajit, but that's also because it's great for low energy. And for those of you who are some of my clients, a number of you guys have mentioned issues with low like adrenal, and I've mentioned that you have some like gut challenges, and I told you to wait until this video came out with Maria and me. This is something that I do recommend and stuff because it is great for energy. So it's great for adrenal support. It doesn't necessarily have the highest level of vitamin B, but it helps your body in absorbing and utilizing it, which makes it really good. And it's especially wonderful for women with low iron. So these are like women who have, or people who have anemia. If you have heavy periods and stuff, like this is great. So with that said, it's not good for people who have too much iron in their body. And Shilajit is so good with iron because it has naturally occurring rocks that are rich in iron. It also helps with bone loss. So again, it's similar to if you have too much iron in your body, if your bone is calcifying, then it's not good for you and stuff. But what's interesting is that like the things that it says that it's good for, they're all interconnected, and they're things that Maria mentioned, like Shilajit. It's known to remove excess fluid, so this could be for edema conditions, but also your lungs. And Maria was saying, like, when you're having parasite issues, this could also affect your lungs as well. So a lot of these things are interconnected, and people just aren't aware of it. And like Shilajit, for example, it's not used to necessarily advertise to treat allergies, but it does help with that because it does contain fulvic acid, which helps with allergies, hay fevers, and stuff. It's really good. And oftentimes, like, you could get them in different forms, but I do recommend the resin because it's the purest. And I want to give you some recommendations on how to figure out whether you have the legit one or not. Is oftentimes they come with like a little spoon. And so what you want to do is like you just dip the tip of it into the resin and then you put it in warm, like hot water. And the real stuff, one, it's not going to taste sweet. It's a little bit bitter, not like in a bad way, but the way like when you drink like tea, Maria's like, I don't know, I like it, but I also like bitter melon. So, Maria just looked like she was going to vomit. She's like, ew. Okay, so
I take it myself. I know it. I even take something that is really bitter, which is actually frankincense or Boswellia serrata, the resin as such, and that is really, it knocks out of your socks. So that's why Shilajit is a little bit better, believe me.
Well, this is subjective. I'm not saying Maria is wrong, and you should probably listen to her over me because then you probably won't be as shocked. I don't think it's that bad, but I also like bitter melon, so maybe I'm not the most reliable. But you could also add honey into it, if you want. But yeah, it should taste bitter. If it tastes sweet, they've chemically altered it. They added some shit it wasn't supposed to. It should melt in warm water. If it doesn't melt, that shit it's something else. And another way that you can do it is you can actually burn it, and it should melt. I don't think you should use these spoons because they're honestly really pretty, but like you can use like a metal cheap spoon or something and melt it if you want. If it burns and stuff, then like there's some toxins or contaminants that are in it and stuff. So that's something to be aware of. And the other thing you can do is look to make sure that they have like lab results. They're third party tested. That's really good. But specifically, the even better ones are the ones where not only are they third party tested, but they test it in different batches. So like they are constantly rolling out new ones. And so you can look at your batch number and they're going to tell you, because like just because they got tested once, who knows what they're doing now, right? But when they tell you like, okay, like for batch number 1 through 500 or whatever, like these are the results, those are the things that you want to look out for. And you can get a sense of what's going on. But the ones that have like 75 to like 85 different nutritional stuff, the higher the altitude, the more potent, the better it is. Something I've noticed is, because I think Maria gets hers, I don't know where you get yours, but you know, she's in Switzerland and I'm in Thailand, is that for me, I'm closer to India. And so there are like, India has some great Shilajit resin, you guys.
I
And
buy it from India directly, Jaymie.
oh, that okay. Well, then you know what? I'm so mad at myself because I did all this research and I'm like, oh my God, I'm gonna be really annoyed if I should have just asked you instead. Because, and I thought I was being so fucking smart. I don't know why. Of course, Maria fucking gets her shit from India because it is the best. This is my
Well,
bad.
I studied in India, so I know where to ask, who to ask, and the Himalayan is the best one you can get.
Yeah.
And you should get the resin. Okay.
So the thing I noticed is, because at some point I want to go to India to also get like structural reintegration and stuff, and I'm close enough that it's just worth the trip and stuff, you know. And I'm astrologically well aspected for India, and it's so funny because like in India it's so cheap, you know, but to ship it, but like a lot of the places in India, they don't ship out here, but if they fucking ship it to you, they're gonna fucking ship it to me. I went through this whole ass rabbit hole, you guys, that I was gonna be like, did you know that they have these services where you could buy something from India and they will mail it to you? But I could have just fucking asked Maria. So you know what? Like, comment
I
below.
agree.
And
Of course, we buy a little bit more for transport costs. It's normal, but
yeah,
I still have it practically, if you want to, from the source, because I don't want it to buy it in the States when I can get it directly from India and Himalayas.
which
I mean,
brand do you get? I want to know now.
I don't remember. I would tell you a lie, believe me. I just know it's from there because when I buy it, some stuff I buy from the States directly,
Yeah,
especially high dosage, say for example, supplements.
vitamin,
But
minerals.
the real stuff, say as we speak now, Shirajit, I buy it from India because there is the source. I mean Himalayas. And I buy sometimes some plants even from Brazil, South America. Okay, I'm just saying. Depends on which plant it is. I try to buy it from source.
Do you know the amount of research I spent trying to figure out where the fuck I could get this? And this was during Mercury retrograde. Remember? I was like, I need to get this before Mercury retrograde. And I was starting to research. We were in pre-shadow, so my brain wasn't 100%. I literally got it like 2 hours before fucking Mercury retrograde hit. And I am so mad right now. But that's not something we need to discuss on video. But oh my God. But while we're at this, Maria, she is crazy and she packs, like she makes her own supplements and pills and stuff and she packs them. So, you know, if you guys want like some legit stuff, definitely hit her up. And apparently she is now, I think we should all make her our drug dealer as she could tell us where to get things rather than me researching this myself. I don't know. I'm so mad at myself.
You should have asked. I should have asked.
I know. This is
But
literally
in
the story of my life.
India, you can get really good stuff. Yes, of course, depends to whom that you go. You have to be careful everywhere, by the way.
Yeah.
But they have good stuff, and I know, of course, people, and that makes the things a little bit easier because otherwise you can buy any BS that it's around that they try to sell you. I had actually one in Africa, and I was so upset. And I said to him, I would never buy from you, even if you would send it to me for free, because you have no ethics. And it's a special plant that
No ethics, yeah.
No ethics. I don't want that because I want that whatever I buy, I want a certificate. I want a certificate that has been tested A, Y, Z, and whatever. I want that. Otherwise, I will not buy from you because I want to give the highest quality to my patients. As I said, I have sworn the oath. It doesn't matter how I do it, but I want the people have the best quality that they can get, and I stick to it. You're like frozen, Jaymie. I don't know if you can hear me.
I'm back.
So
I'm sorry.
you're back.
Oh,
So I was just saying that I want the best quality for whoever, even if it's an animal, and that's why I ask always. I mean, my suppliers, they know it. They don't even discuss it because I want certificates that has been tested for whatever test they have. I want to know it and I want to have it.
yeah.
Quality has to be priority because I can buy for the same plant somewhere else, but I don't know the supplier. I don't trust. If my gut says no, I will not try it. He can send it to me for free. I will not try it because you don't know pesticides. If it's beside the pesticides, all the metal, the heavy metal that might be like lead and mercury and you name it. I want even the zeolite. I buy it from Germany.
Yeah. Oh, I remember you were telling me about that.
I
'Cause
buy
I
it
remember being
because
like, where do you recommend that? And you're like, Germany. And I was like, that's not helpful to me.
no, Germany because they have. I mean, even Germany has they are not active anymore, but they have volcanoes there too. I'm just saying, if you are near to a volcanic area, which are not far away from it, but
No.
depends. The one that I buy from Germany. There are certain things that they are specific from a specific country,
Yeah.
and I stick to it because if it grows in Brazil, then I buy it from Brazil. You know what I mean?
Yeah. You want to go to where the native plant, where the plants are native. That's going to be like
Yeah,
the best. The soils, they're going to be the most like best for that plant and stuff.
yeah.
Absolutely.
Because it's important. As I said, I want to be quality, and I want the people get the most benefit out of it.
Yeah. So, moral of the story, you guys, for parasite cleanses, try out, pair it with a liver cleanse to maximize the detox. Fulvic acid, zeolite, use the zeolite that is safe for plants and animals. Fulvic acid, you can get something that has fulvic acid. You can also get the shilajit resin. The other moral of the story is Maria is now officially our drug dealer. We should just ask her before we go down these rabbit holes. And just so you know, Maria, after we get off the phone, I'm going to make you listen to me bitch about all the sites I went through. I looked through all the carriers. I did all the math. I'm so upset, but that's fine. So focus
Just
on
calm
that.
down.
Yes. Speaking of, and I also need to be focused because the special offer that I was telling you guys, Maria and I, we're going to be starting to make webinars on medical astrology, combining health and stuff. So kind of similar to this, Maria is going to be talking about the medical aspects. I'll be sharing the emotional, psychological, spiritual aspect of things, the things that you can do, some practical insights. And so what we would love to hear from you guys is what health topics do you want us to talk about? We've already discussed some of this. One of the things is we're going to be talking about cancer because that's a big thing. We're going to be doing something that's really important to me is being diagnosed with endometriosis and with medicine being based on the white male body. And as a woman of color, that leaves me at a greater disadvantage. And women's health is one of the most underfunded. Gynecology is the most financially underfunded, the least researched, and most of it does go to fertility, instead of really going to, well, how do we, instead of like trying to force pregnancy through in vitro, through like these impossibly insane prices and shit. It's like, they're not looking at, well, what can we do to create a safe womb in order to have pregnancy and stuff. And so there's a lot of reproductive issues and women's health issues that's like hard to come by. So we're going to be doing a webinar on that. But if there's anything else that you in particular want us to focus on, please comment below in the video. I'll also put up a Google Doc link so you can fill that out with more specific information as well, just so that we can custom tailor everything to you.
Yeah.
Thanks for watching, everyone.
Thank you. And I hope that it helped a little bit to understand more about parasites and what is involved with it and how you can stay healthy or become healthy and remain healthy.
Yes.
Okay. So thank you very much.
Thank you, everyone. Bye.